Thank you, Ron. Well, Youth First, such an important and powerful organization, supports our area young people in so many important ways, including mental health and well-being programs. Elizabeth Christmas is a licensed social worker and director of services for Youth First. Kent Leslie is the assistant director of programs. Welcome back, guys.
Thank you.
Good to see you. This is such an important and also painful topic for those of us who love and care about young people, as you do. Elizabeth, let's begin with the mission of Youth First and let people know how many boots you have on the ground out there in the area schools. Lots.
Yeah, thank you. So Youth First exists to strengthen youth and families in the communities that we serve. We're in 14 counties, 126 schools, 100 licensed mental health professionals, over 300 research-based programs coming up this year, and we are looking forward to doing those programs. And one of those programs, the one that we're going to talk about today, is called ACT, which is a classroom presentation that we do with students to provide suicide prevention information for them.
It's just one of the many programs, Kent, you will do. Let's talk about Suicide Prevention Awareness Month, which we are currently in, and why that awareness is so important for educators and parents and grandparents and all of us.
Absolutely. September is Suicide Awareness Month. It's a month for focus and to raise awareness. Unfortunately, suicide in our country is a major health concern, and we lose about 50,000 people in the United States each year. White males of working age are who dies the most, but anybody can be at risk of dying by suicide.
Well, in your programs for the schools, and I'll just kind of throw that out to both of you, are you educating the educators? Is that part of the goal, or working with the kids too?
Absolutely. So we do a lot of suicide prevention training with teachers and other school staff to help them know what to do if they experience a student that might be thinking about suicide. But then also we do classroom presentations with students to help them be aware of what to do if they're concerned about a friend. So the ACT program that we facilitate, we were able to provide that for over 4,000 students last year across our footprint, and also over 400 suicide assessments of individual students. So it's very important. The ACT acronym stands for acknowledge, so acknowledge that your friend has a problem and needs help. And then the C stands for care, show them that you care. And then the T is for tell a trusted adult, because we know that a lot of times kids talk to other kids about these things, but they don't necessarily go to an adult. And so we want to empower the kids to know what to do, how to help a friend, and not keep something like that a secret.
So important. And Kent, we just have about 45 seconds left. Give us some signs for all of us to look for if we feel we have a troubled youth.
One of the things we talk about is the lethal triangle or the lethal triad. So if you have these three things present, then the risk of suicide is high. So an upset person, usually that's regarding relationships, romantic or familial or family relationships, drug and alcohol use, and access to the means, which are the most deadly in our country, are firearms.
Yes, and all of that together, that is
Correct.
The lethal triad.
Yes.
For moms and dads and schools out there, can they go to your website to get more resources? How can they do that, connect with the material?
Absolutely. Our website is youthfirstinc.org. You can find who the mental health professional is in your child's school and get in touch with them to find out what they can do to help you or your child.
Well, and I think it's, to highlight in this month that many suicides can be prevented if we just are aware of these wonderful things that we need to know. Thank you both for the work you do.
Thank
we
you.
appreciate you.
Thank you. Thank you for having us today.
More Lifestyles right after this.